I'm now at 7:34. Of course, we brush our teeth, we floss our teeth, but do we need to use mouthwash as well? One Atlanta dentist says it depends on what's going on inside your mouth, right? The Fox Medical team's Beth Galvin is here to explain the ins and outs. And you know, sometimes I wash it out, it just depends, but actually buying the mouthwash.
Yeah, Constance, I think many of us kind of buy that mouthwash because we want that little bit of added protection against dental decay and germs. But there are different types of mouthwash, so to pick the right one, you have to think about what your needs are. When it comes to mouthwashes, Inman Park Dentistry's Dr. Alex Rodriguez says you have plenty of options, from over-the-counter to prescription to make-it-yourself rinses.
As a dentist, I recommend people use any and all of that.
But Rodriguez says this is really a case of to each his own.
People that have mainly issues with their teeth or a history of cavities or a lot of fillings, I strongly recommend they use a fluoride mouthwash.
ACT is one popular over-the-counter fluoride rinse that may help fight decay, Rodriguez says.
If your gums aren't doing well and they bleed a lot, and if you have any gum disease, then we really should be using a whole different class of mouthwashes, the antiseptic mouthwashes.
Think Listerine or prescription rinses, which can help kill germs. And some people make their own rinses with diluted bleach or hydrogen peroxide.
So the key, though, is to dilute it. You don't want to be using straight peroxide. It can burn your gums. It can burn the tissues.
Same thing with bleach. Dilute it. Overdoing it can be risky.
Aside from the horrible taste, a bleach solution is going to not only kill the bad bacteria, but it's also going to kill all the good bacteria in your mouth.
And oil pulling is something also gaining popularity.
Basically, you take oil, generally coconut oil. You can also use sesame oil, and you put a glob of it in your mouth. I say glob because coconut oil at room temperature is usually solid.
You chew that glob until it melts in your mouth.
And you swish with it. And you swish, and you swish, and you swish for 20 minutes.
Which Rodriguez says is a lot of swishing.
It's far better to just take 2 minutes to brush, 1 minute to floss, 30 seconds to swish with a standard mouthwash like Listerine or ACT or something, and then you're done.
And mouthwashes that contain alcohol can dry out your mouth and raise your risk of decay. So some dentists recommend steering clear of those alcohol-based mouthwashes. And mouthwash isn't designed, though, to replace the need for brushing and flossing. Unfortunately, Constance, you still got to do those steps.
Still got to floss.
Yes.
20 minutes with the oil.
Yes.
I don't think anyone has any time for that.
No, I don't think so.
But speaking of time, how long should we be using our mouthwash?
So generally, I think most dentists agree you want to be gargling about 45 seconds is pretty good, a good amount to shoot for. Kind of getting it all in, rinsing it through your teeth.
And I am guilty of using the mouthwash and then using water to wash it out again.
Yeah,
should we be doing that?
Well, it doesn't taste great, and I do the same thing. Like I rinse with the mouthwash and then really quickly rinse out with some water. But you do want to leave the mouthwash in there for a little while so that it can do what it's supposed to do. So try to hang on a few minutes after before you rinse your mouth.
Oh, teeth problems. It's always an issue. All right, thank you so much, Beth. All right, time.